Hello, and welcome to another set of notes in our abnormal psychology and treatment unit. We're going to talk now about depressive disorders and then bipolar and related disorders. You should know that these used to be all in one, and they were called mood disorders. So that kind of just gives you a frame of mind as to what both of these are about. These are probably the most commonly or well-known disorders that we will talk about in this unit, but it is important to make sure that you've got the psychological kind of vocabulary and lingo to use in case you were ever to write like an FRQ or essay about these. So again, they are now two separate categories of depressive disorders and bipolar and related disorders in the DSM-5. We're going to talk first about depressive disorders, and the big one to talk about is major depressive disorder. It is super important for you to understand that depression is the, quote, common cold of psychological disorders, because it is exactly that, right? Between 6 and 10% of the U.S. population is clinically depressed. It is the number one reason that people seek mental health services, even over anxiety. Women are twice as likely as men to experience major depression. Approximately 1/4, right? 1/4 of all females will experience an episode of major depression at some point in their lives. So really, really common. Symptoms must last for 2 weeks without cause, right? There can't be like a very normal cause that would elicit these types of behaviors from someone, like a major loss of a loved one, right? And for those who are grieving, symptoms must last for 2 months. Now, I should note that that doesn't mean that the loss of someone important or a loved one doesn't cause this to happen. It just has to be a little disproportionate. So either depressed mood or loss of interest or pleasure in almost all activities. And I'm going to kind of pause there for a second and make sure that you have this down, at least have this understanding about major depressive disorder. Please do not say that being depressed is being sad. Sure, that's part of it, but I want you to think of back in your states of consciousness unit where we talked about stimulant drugs versus depressive drugs. A depressant is something like alcohol that will slow down your central and peripheral nervous system, right? It's going to slow down your autonomic nervous system as well. So major depressive or depressant, you could say, but that's not it, so don't ever write that. Depressive disorder is a depression or decrease in brain activity. So again, don't just think it's emotion, it's depressed brain activity. And that's what explains this idea of a loss of interest or pleasure in almost all activities, even the ones they used to love. And so then there also has to be at least 4 of the following characteristics: marked weight gain or loss, constant sleeping problems, agitated or greatly slowed down behavior. There's lots of fatigue, right? Because the body is slowing down and therefore unable to kind of deal with the regular flow of the day. Inability to think clearly, feelings of worthlessness, frequent thoughts of death or suicide. So what might be some causes of major depressive disorder? And we're going to consider 2 here. Biological. So the lack or insufficient amount of neurotransmitters. This is absolutely so darn important that you understand that major depressive disorder biologically in the brain is a lack of serotonin. That's exactly what it is. Also, and yes, you need to know this, norepinephrine and dopamine. Okay, so it's a lack of serotonin, norepinephrine, and dopamine. Most of the time, the kind of trademark one to know is a lack of serotonin. Social cognitive causes, meaning negative thoughts, influence negative behaviors that influence the situation and in turn influence thought patterns. So it's just this idea of the depression cycle, and that there's a negative stressful event, right, that causes the pessimistic, very ruminating, explanatory style of what is happening, and that they can't stop thinking about it. They're just ruminating in a very negative way over what's going on and how they're feeling. Hopeless and depressed mood or state, which then hampers the way that the individual thinks, cognitive, right? And acts, behavioral, and thus fuels personal rejection, going right back into another stressful event, and it goes round and round. There's also something called persistent depressive disorder, which is formerly dysthymia. You really should know this one as both of these. And although it's less disabling, dysthymic disorder or persistent depressive disorder is marked by chronic low energy and poor self-esteem. It's seen as a more low-grade, like boiling underneath the surface, longer-lasting depression than major depressive disorder. So now we'll shift and talk about another category in the DSM-5, which is bipolar and related disorders. So bipolar disorder being the big one that we have to understand, formerly called manic depressive disorder. And it's important for you to understand that because manic depressive shows you the two aspects, hence bipolar, right? Bi being the two aspects of bipolar disorder. And it's the alteration between the depression and manic signals, manic states that signal the bipolar disorder. So in the depressive symptoms being just as major depressive disorder, very gloomy, withdrawn, inability to make decisions, tired, slowness of thought. Whereas then the manic symptoms being elation and euphoria, overexcitement, desire for action and wanting to do, hyperactivity, also with that desire for action, and multiple ideas, just like almost like an overdrive of productivity. Many great writers, poets, composers have suffered from bipolar disorder, and during their manic phases, their creativity surged and then dropped off during their depressive phases, which makes a lot of sense, right? That they were able to be so super productive in their creativity during those manic stages. There's bipolar 1 and 2. Bipolar 1 being an experience of manic episodes and usually major depressive episodes. Makes total sense, right? But then bipolar 2 is where you experience mania to a lesser degree, called hypomania. And most patients who experience hypomania do not see it as a problem. Yet the people around them may be concerned about their erratic behavior, and it's at least 4 days of hypomania. And then there's cyclothymic disorder. They have the hypomanic and depressive symptoms for at least 2 years, yet symptoms do not constitute full major depressive episode or mania. So what might be some causes? There's a biological component. Evidence for inherited predisposition is very strong, and that 2/3 of those with the disorder have a family history of a mood disorder, specifically bipolar, and they appear to be more psychosocial factors in triggering new episodes or in preventing them. And it's found that stressful events often trigger the manic episodes, and that they think, wow, there's something stressful, I have to rise to the occasion, and they overproduce, right? They overrise, you could say, to the situation. PET scans show that the brain energy consumption rises and falls with the manic and depressive episodes, which again is just evidence that it's not just being sad and it's not just being excited. It's brain activity that's involved, just as if someone were taking a stimulant or a depressant, right? And that in the manic state, the brain is super stimulated, as you can see by PET scans here, whereas in the depressed state, it's very underactive, right? The brain activity is depressed or slowed down. So this being a quicker one, but I hope it was short and sweet for you, and you kind of were able to see that, yes, these are really commonly known disorders, but you got to be able to talk about them or write about them, right? With very specific terms that let people know that you know these versus other ones. So thanks so much for tuning in. Please make sure to subscribe to my new YouTube channel and stay tuned for my next video. Thanks so much.